happy rainy day today.
What's up, guys? Hope you guys had a great weekend. You're back at you here from Mill Pond.
Mill Pond. Today we want to talk to you about diverticulitis.
It's a common issue a lot of people deal with.
Yeah, they do. And especially like all of a sudden during the holidays and stuff, it's like, grandma got run over by diverticulitis and she had to go to the hospital, and it's like she's having surgery. And it happens often. 15 to 20% of people who have acute diverticulitis end up needing surgery. But guess what? A lot more than that end up having surgery on that first day due to complications, due to whatever it may be, due to just acute pain. It's like, I don't know what's wrong. We've tried the antibiotics. He's going to talk about that in a second. Like, just cut your colon out.
Yep.
Start moving stuff.
Because what we see reoccurring flare-ups, right? So you start to get pain, abdominal pain. It can change your bowel movements. So what happens, and let's talk about what the approach is. And first of all, let's talk about what diverticulitis is, because when you put itis on the end of a word, that just means inflamed.
Yep.
And you guys constantly hear us talking about inflammation. Why? Well, because regardless of what kind of doctor you, regardless of what health field you're in, we all agree that inflammation causes all disease. So if we can find out the source of the inflammation, if we can find out why the inflammation's there, and remove the cause of the inflammation, then the chance of you having another diverticulitis flare-up is obviously much less. But this is the story, and we see it all the time because patients don't get a flare-up and then call us.
Correct.
Right? Patients get a flare-up, and what do? Well, a lot of times, if it's bad enough, they'll go to the ER, right? I mean, because you can get some pretty bad pains.
I mean, like debilitating pains.
Yep.
Yeah.
So how the story goes, you go to the doc, you go to the ER, wherever you go, and you tell them about your symptoms. Usually there's not much diagnostic testing going on. Usually it's like, well, you've got diverticulitis or you've got some inflammation in your gut. When's the last time you had a colonoscopy? Well, I'm on my routine. I'm doing that. Okay, fine. Well, let's just go ahead and start you on antibiotics. So what's the problem with that?
Antibiotic usage?
Yeah, just start a broad spectrum antibiotic.
Yeah, I mean, they don't even look at the fact that, like, what an antibiotic can do. An antibiotic is going to kill some bad things in you. Sure. An antibiotic is going to tear away all the good things in you. Sure. Is the antibiotic right for you at that right time? Will that antibiotic actually kill what you're fighting and what you actually have? Because I think you could make a case that, like, if this antibiotic is going to kill that for sure, that, maybe it's okay to take it, but now you got to do things to rebuild. Because again, an antibiotic is not your answer. An antibiotic is going to cover things up. An antibiotic might kill this infection, but then what's it going to do to your good bacteria? What's it going to do to the balance? Is it going to feed an area for yeast and for bacterial overgrowth and like parasites and different things, and decrease your stomach acid and your body's ability to absorb vitamins and minerals, and hell, even the antibiotics, like, so that it can cause so many different things. But the question is it the right damn antibiotic for you?
Yep, exactly. And guys, because listen, we're not going to sit here and tell you that antibiotics is a bad thing. I mean, there's times where you're going to need an antibiotic. Hopefully not, but there may be a time. Yeah, thank God we've got that antibiotic, so it can save your life. Guys, you can die from an infection. We understand that. The problem is they're way overused, so that when you do need an antibiotic to be effective, they're not, right? But still, just like Doc said, is that the right antibiotic for you? Because see, even something that's not a bacterial infection can cause diverticulitis. So if you have that outpouching called a diverticula that's developed inside of your colon, if something did get stuck in that area, or if you did have some food that got stuck in the area, that's going to cause infection and inflammation as well. So again, guys, you hear our motto all the time. It's what? It's we don't guess, we test. And so instead of just, it's kind of like using a machine gun inside of your gut just in hopes we're going to kill the infection. They're just going to blast your body with antibiotics, and again, more times than not, you're going to have another flare-up. So what's that mean? Well, it means number one, didn't get rid of the problem, right? And so, just a quick story, guys, and I've got these sheets here because if someone has a diverticulitis flare-up, or if someone has abdominal pain, symptoms of diverticulitis, first thing we're going to do is run a stool test. right? Now, most likely we're going to accompany that with some food allergy testing, right, so we can remove those triggers. But this is a patient that had some abdominal pain, went to the doc, they said you have diverticulitis. They did IV antibiotics right then and there, sent home with a week of antibiotics, and then she came to my office. Now, this was a patient that I've worked with some other stuff. I haven't really done gut health with her, but she knew where to go. So we got testing done. Guys, after all of those antibiotics, she had 2 full-blown bacterial infections still. So if we had not have done this testing, in my opinion, it was a matter of time before she had another flare-up, right? And then again, the flare-up gets worse. Now they're cutting out portions of the colon. They're just doing very invasive things, because if the antibiotic didn't work, then what's the other tool? Well, I mean, it's a knife, right? So cool thing is, guys, is with our labs that we use, is they will test us. They will test these infections next to not only different herbs, but also different antibiotics. So this is really cool, guys, and this is the kind of this got my patient, a little upset, but I told her it's the model she's in, and this is kind of just the approach that they have. But this testing antibiotics, the most common antibiotics used is amoxicillin and ciprofloxacin. So these are just 2 different antibiotics, the most common antibiotics. Now, these are 2 infections. She had both these infections. Now, the one infection, you guys probably can't see it here, but basically what it's saying is that both of those antibiotics were effective in killing this infection. But yet, the infection was still there after all of the antibiotics that they used, right? On this one, those antibiotics were resistant, so these would not have been effective. So she could have kept taking those antibiotics, it would not have been effective in killing this bacterial infection, right? And so the importance of the testing we do, guys, that's why we get long-term results. That's why when they say, well, once you have diverticulitis, you just need to watch what you eat for the rest of your life, or you're going to get a flare-up. Mm-hmm. But is that the truth if you can find out what caused it in the first place?
Well, it's too, the people who get diverticulitis, so they're just risk factors in how you are if you're going to get it is obesity, smoking, lack of physical activity, a diet high in red meat, fat, and low in fiber, stomach acid and other things. I mean, I eat a lot of red meat and I eat a lot of fat, so I would fight that, but that's just what this says. And then certain medications. But listen, if you're overweight, you're unhealthy and you're inflamed. If you're smoking, I'm pretty sure that's not good for you.
I'm pretty sure that's a very bad thing to be doing.
It's crazy. Like when you go overseas and you look at when they got what's the thing, duty-free stuff. Like literally, like when I was there last time coming home from wherever I was, it was like on the cigarette cartons, it was like, if you smoke these, it will kill you. But like half off, so like people are like buying them like crazy. It's unbelievable. Like we know they're bad for us, yet you still do it.
Yep.
And then you wonder why you have diverticulitis. You wonder why you've had 5 gut surgeries and you've lost 2/3 of your colon and you're overweight and just like all these things. Like you're just sick. So yes, like there are better ways for you to treat your symptoms. You got these symptoms, like there's better ways to treat those symptoms while you're trying to figure out like exactly what's going on underlying. Because you said at the end of the day, you got to put a fire out. Whether you're going to put a fire out like with medications, or whether you're going to put a fire out with homeopathic or like wellness way type herbs. Understand that medicinal herbs are actually 2.5 more times effective than drugs and antibiotics themselves. And so you think, well, but herbs, and somebody wrote emails like, well, I don't really believe in herbs. I think you should get all your stuff from your food. Well, sure, you should get all your stuff from your food. But you're saying if you don't have stomach acid and you can't break down the stuff anyways, you're not getting it from your food. You're not getting it from your supplements. You're not getting it from your antibiotics.
Yep.
You have to fix you.
Yep.
You have to fix your physiology. You have to fix what's wrong with you. It's not about just treating symptoms, but like you keep getting diverticulitis, you keep having pancreatitis, you keep having IBS and all these other things. It's like, do something about it. Yep. If you're overweight, change it. Quit being lazy. Yes, we said it, and it's okay. If you're overweight and you go out, but doc, I don't have the energy to do it. Well, then we need to figure that out.
Yep.
We need to figure something different out. Because you keep going on this path doesn't end well. You know where it ends up. 1 in 2 people getting heart disease, 1 in 3 people getting cancer. Do you want to be that statistic? It's not going to be me, though. How the hell is it not? It's either me or you. And I do a lot more than you probably do. So it ain't going to be me. I mean, statistically, it's going to be you. So what are you doing? What are you doing to make sure that it's not you and it's someone else? You have to work at it. You have to work at it every single day. But you have to look in the right places.
Yep, and that's a good lead into what I was wanting to talk about here, because look at the right places. Because if you look at what they're telling you to do for prevention of diverticulitis, they're telling you to exercise. They're telling you to have a high fiber diet, and it's pretty much what they're telling you to do to prevent it. So we can give you some tips right now that are going to be way more effective in preventing diverticulitis, guys. So number one, I think we should start with stomach acid.
Big.
Stomach acid is so important, guys, and so many things that you're doing, including stress, is reducing the stomach acid. I mean, guys, if a bacterial infection is one of the major things that can cause diverticulitis, just by increasing stomach acid, doing things like betaine HCl, apple cider vinegar, it increases the acidity, therefore it's going to most likely kill off those microbes before they get into your gut. So just by increasing stomach acid is going to decrease risk of diverticulitis. Agree?
100%. It's going to reduce the risk of a lot of other problems too if you have a proper upper GI, which isn't going to flood on the rest of your body. Number two thing that you can do, now I'm going to say this and preface this by saying, well, that's it. So eat anti-inflammatory foods.
Right.
Eat good foods. Eat more things like vegetables and celery and beets and broccoli and blueberries and walnuts and chia seeds and bone broth and coconut oil, right? All these good things that are anti-inflammatory. Yet, if you just went out and started eating all those things and you have diverticulitis or you're prone to it, guess what? Some of those things could absolutely trigger diverticulitis. Why? Because you're allergic to all of it.
Yep.
And if you're eating healthy foods, but you're allergic to healthy foods, don't eat allergic healthy foods. Like, you're just triggering inflammation. But you have to be looking in the right places. You have to know what you should and shouldn't be eating. So, Doc, what diet should I be on? Exactly.
And there is no one diet, guys. There's no one diet for anybody. Now, we can give you a basic, you can buy a non-inflammation diet book and follow the basic book, but you can have 100 people follow that diet, and there could be, I would say a good 25, 30% that they still don't feel well. Why? Well, because they're allergic to so many of those non-inflammatory foods, it's still causing inflammation. And guys, when you have inflammation in your gut, the likelihood to develop food allergies goes up.
Yep.
Right? So you're having a risk of developing more food allergies. It's like, well, I'm doing the elimination diet, I'm doing all these things, but yet I still feel horrible. Guys, you got to stop guessing, and you got to test properly.
Elimination diets, guys, are hard to do. They can be effective, yes, sure.
Yep.
But they are hard to do, and they are stressful to try to figure out what it is. And
Right.
Guess what? One of the biggest things that cause not just diverticulitis, but from cancers to heart disease to any kind of inflammatory problem is what? Stress.
Yep.
So why stress yourself out for $200 just to find out if you're allergic to something? It makes a lot of sense, right? And then the other one, like when we're talking about food that you need to avoid or at least cut down, and people don't like this because, again, when it goes into stress and goes into other things, you gotta stop drinking alcohol.
Yep. It's ruining your gut.
It's ruining your gut. It's ruining your body. It's ruining your life. It's probably ruining relationships. It's probably ruining a lot of things. But yet you're just like immune and numb to it, and you just keep doing it. You gotta stop drinking alcohol. Do I drink some alcohol? Sure. Not daily by any means. We get together and watch the Cowboys put some whooping on someone.
So even more rare that he's drinking, guys. So.
Yeah, maybe. But yeah, just reduce it. I didn't say eliminate it. Eliminate it is a different topic, and that depends on you specifically.
There's,
and like what's
there's a lot of people out there that need to do that.
It's like yeah, you got to get rid of it. You got to stop for 30 days or 6 months or whatever it is. And do you choose health or do you choose alcohol? Like we have those decisions. We can have real decisions about it. But if you're struggling with diverticulitis, give up alcohol for 30 days and see how you feel.
Yep.
What else?
Well, just toxins. I mean, putting any kind of toxins in your body. If you're putting artificial sweeteners, it's ruining your gut. If you're just again, junk food, right? Artificial food, fake food, McDonald's, Burger King. It's the time of year. Everybody's in a hurry. Everybody's running around. You're running around shopping. Let's just hit up, McDonald's. Guys, go to somewhere like Chipotle. Go to somewhere like Core Eatery. Go to somewhere where you can still get real food on the run. Now, there's still good choices you need to make when you go to those places, but this time of year should not be an excuse because guys, heart attacks, flare-ups of all diseases are more common right now today in this time of year, and it's because everybody's got an excuse to eat like crap and stress and stuff we've been talking about for the last couple weeks. Guys, diverticulitis is absolutely preventable, reversible. It's not a disease process. Once you get it, you're screwed. My parents got diverticulitis. I'm going to get diverticulitis. Guys, don't fall into that trap, okay? There's so much you can do, but again, you got to find out what's causing your diverticulitis. It could be a certain food. It could be a certain bacterial infection. It could be a yeast overgrowth. There's a ton of different things that could be causing diverticulitis. So, the headline of ours was, what's causing your diverticulitis? We have no idea, but I guarantee you we can find out.
Yep. Proper testing. One thing about inflammation, people automatically think about, like, I'm in aches and pains, is you take NSAIDs and non-steroidal anti-inflammatories. Well, you're twice as likely to get diverticulitis when you take chronic NSAIDs. So that's not the answer either. But again, what is the answer? Reach out to somebody who knows what they're talking about. Reach out to somebody who has a different approach. If what you've been doing for the past 5, 10, 15, 50 years for your health is not working, if you're sick, if you're on all these drugs and you're still sick, if your blood work is normal but you're not normal, you need to look somewhere different. You need to look for some help, and you need to look in a different direction. Wellness Way can offer that for you. We are here to help you. We would love to sit down and talk with you about diverticulitis, about what it is. So if you ever need help, reach out to us. We would be honored to talk to you on the phone, in the office, whatever it is, and give you guidance. Otherwise, please ask questions, because that's how you are going to get advice and answers and basically free healthcare.
Yep.
We're going to give it to you, whatever you need. Ask it. We will give you specific answers based off of what you ask. Please like this. Please share this. We are so thankful for you guys doing that. And that being said,
catch you guys next time.
Catch you next time.